Okay. Hi, my name is Allison Hammond, and I'm a physical therapist assistant student at Carroll Community College.
And my name is Tabitha Gretz. I'm also a physical therapist assistant student at Carroll Community College. Today we're going to talk to you about peripheral neuropathy and how to affect someone's gait. This video will mostly focus on diabetic peripheral neuropathy and how someone with this disorder may have to get an amputation of their first metatarsal phalangeal joint, or the MTP joint as we will refer to it as. We will show you how this amputation will further change a person's gait.
Peripheral neuropathy is defined as damage to the peripheral nerves. This may be caused by metabolic disorders such as diabetes or injury to the peripheral nerves, infections, or other diseases. It is also important to note that peripheral neuropathy starts distally, so it affects mainly the feet and the hands.
Peripheral neuropathy usually results in weakness and sensory issues. For an example, someone with this condition would have weak dorsiflexors because of the deep perineal nerve is affected, resulting in foot slapping or foot drop. Also, this person would have a wider base of support and stomp their feet on the ground to help them feel the ground. The stomp is what gives the patient tactile feedback to know where their feet is at. This is how someone with peripheral neuropathy's gait would look like. This is peripheral neuropathy gait. You will notice a wider base of support and no heel strike. There will also be toe dragging, you can also notice foot slapping. Now we're going to talk about peripheral neuropathy caused by diabetes. Diabetes is the leading cause of peripheral neuropathy. Diabetes impairs the ability of the body to turn nutrients like sugars into energy. This increases the amount of sugar in the bloodstream, which causes an increase in water in the Schwann cells that are wrapped around the nerves. As these Schwann cells expand, it compresses the nerve, causing damage.
Another way diabetes causes peripheral neuropathy is by neuroischemia. Neuroischemia is nerve death due to decreased blood flow caused by the diabetes. The nerve's the lifeline to the surrounding tissues, so when the nerve dies, the surrounding tissues like the muscle tissues, they actually die off as well, or atrophy.
When this happens, a person with diabetic peripheral neuropathy may have to get an amputation of their first MTP joint. This is how their gait would change with this amputation. This is a right MPT amputation with peripheral neuropathy gait. So the person will still have a wide base of support, toe drag or foot drop, and no heel strike. But this person will also have no toe off.
How long does it take? Like 30 seconds? They're in slow mo. So they're like 20 seconds.
Here's a patient that had transmetatarsal amputation. Notice as he walks, he does not have heel strike on the left or toe off on the left. Treatment for someone with peripheral neuropathy would include wearing an AFO to prevent the foot drop. You can do biofeedback or Russian stim to stimulate and retrain the weakened muscles. You would want to do strengthening exercises for the hip flexors and extensors, knee flexors, extensors, plantar flexors, and dorsiflexors. You would also want to practice proper gait training with these patients. Patients with diabetic peripheral neuropathy or anyone with type of peripheral neuropathy would have specialized shoes with a thicker sole, so if they were to step on a nail or a tack or anything else sharp, it would not go into their foot because they wouldn't be able to feel that. If the patient has an amputation, they could use a single point cane in the opposite hand from the amputation to increase stability and decrease any lateral flexion that the patient may have while walking. However, it is not needed if the patient is balanced and is strong enough. Notice as the patient walks with his AFOs, he is able to have heel strike. However, once his AFOs are removed, he loses his heel strike and he walks with a wider base of support. He is able to pick his feet up but have the foot slap.